When it comes to the matters of the mind, do you think or does your mind think that they can figure everything out on their own? Well, I don't think so, and you shouldn't either. Today, we are here, right here at Radio Olive 106.3 FM. My name is Bani, and we are talking about the misconceptions in mental health. I have a very special guest with me. Hello, and welcome to our studios. You are Dr Samin from Naseem Healthcare. Hi.
Hi.
How are you doing? How's your day?
I'm good. How are you?
Okay, so today, as I said, we are here to talk about the misconceptions in mental health, and there is literally no one else who encounters this more than you guys, right? So, the number one thought that comes to my mind is usually there are a lot of algorithm and content online that people come across, and they do a lot of self-diagnosis. Okay, I have this, I have that. What is your first reaction to someone, a patient who comes who already believes they have a particular type of problem?
The problem with online media these days is because the problem with online media these days, the main problem is that most of them are like based on revenue and things like that. So they may not be qualified enough to talk about these things. And when it comes to psychology itself, there are like different types of psychologists. There are clinical psychologists, there are therapy psychologists, counseling psychologists. It's always better that you get the advice from a clinical psychologist with a proper degree and things like that. So every Tom, Dick and Harry can talk about mental health just like that.
Right.
But it's very important that what information you're getting, it should be from a relevant source. It should be from a source which has the proper degree, proper qualification, so that you don't get, confused.
Yes, that makes complete sense. What would you say is the bar that if someone is struggling with a problem, what's the bar when people should reach out to a certified professional for help? What is that bar?
Very good question. This is see, we all get anxious, we all get sad, we all feel happy, we all get irritable. These are all normal emotions.
Right.
So when you decide to seek help,
Right.
so either the intensity of such emotions are more, or the frequency of such episodes are more, so much so that it starts affecting your daily functioning, whether it is your professional life or your personal life. When it starts interfering with your functioning, yes, you need to see a psychologist or a psychiatrist for that matter.
That makes sense. Coming to, if someone wants to self-educate themselves a little bit more about understanding what is going on with them, what could be the right sources to learn about certain topics?
The problem with that is the number of sources online.
Yes.
You might find more of bogus sources than proper sources. Often you can reach out to people who are, like I said, well qualified enough people. You can find contacts of these people even online these days. It's not like you have to go physically to a place and see a person. So you can reach out to people like them. You can reach out to proper sources which has credibility. Like even when it comes to information regarding COVID, we always say that you should you should look online for CDC and things like that, or WHO information sources. So the same information is available even in those platforms as well. As in World Health Organization also has platforms regarding mental health. So those kind of sources will be more credible than looking online for these sources.
Yeah, any general other source. That makes sense. My next question would be a recent development. I am sure you also encountered it, which is the uprise of artificial intelligence and chatbots, which people reach out for help when they need help, when they want to know what's going on. What is your reaction to that, and how do you deal with that?
It's somewhat like saying that you don't use social media at all. And either you don't use social media at all, or it's like you cannot completely ignore all these things. So it's important that you use it to your advantage. Even when it comes to kids, always there is this question about whether kids should be given access to tablets, mobiles, things like that. But there's always a path of judicious usage of these things as well. So when it comes to artificial intelligence, I can assure you that to a certain extent we do get good information. And like the chat we had before the conversation we had, for doctors it becomes easy to sometimes get the information faster. So even if we have a lot of knowledge and we have a lot of experience, it's not right to be arrogant and say that, okay, I know everything. So sometimes you need to get information. So there should not be any shame in the doctor's mind or a psychologist's mind for that matter to look for latest things. So sometimes we do use these techniques as well. But we make sure that whatever information that's come over there, whether it has a proper research backing,
Yes.
whether it is based on credible research oriented websites and things like
Yes.
that, and we don't completely swallow it
Yeah.
as such.
Yes.
So we look at other resources as well and arrive at a diagnosis and
Yeah.
things like that. When it comes to coming back to the question that you asked, it helps to a certain extent to understand what's going on with you, but often what happens is like you look only at one aspect of it.
Yes.
Say you have attention concentration problems, you end up diagnosing yourself as having ADHD these days,
Yes.
because there is a new fad about
Yes.
ADHD.
Yes.
And there are confusions even among psychiatrists regarding what to diagnose sometimes. There are always problems with those things as well, because sometimes when the patients, when they walk in, they tell that, doctor, I have ADHD, I want this medication. So that becomes a problem.
Yes.
So you need to have an open mind.
Yes.
Okay, you might have a diagnosis in your mind, you might think about certain symptoms in your mind, but we can have a chat, we can have a discussion about it. And I always believe that even if it's a doctor, it shouldn't be like a one-way communication. There should be a discussion between the patient, the client and the doctor, so that all your concerns are addressed.
Yes.
It's very important that you become a patient listener.
Yeah.
Often people ask me, like, being a psychiatrist, you should talk more. No. Being a psychiatrist or a psychologist, you have to be a patient listener first. Because unless and until you're willing to listen to what your client has to say, it doesn't work.
Yeah.
And to a certain extent, this itself can help when it comes to recovery. Being somebody who is able to listen to what the problems they have, itself helps in the recovery.
Wow, that's such a positive message, and it's such an enlightening thought, right? That we need to listen more, even as professionals. Listening more is such an essential part. Okay, you mentioned medicines in the answer that you gave, and there is a lot of misconceptions regarding medicine for mental health as well. A lot of people are hesitant about it. What's going on there?
Often the first question when they come in, not the first question, basically after everything of the discussion has been happening, when I tell them that, okay, I think you need to be on medications, it's like, oh, isn't counseling enough? Isn't therapy enough? The problem with people is generally, like, what we do is, unless and until it starts interfering with our daily functioning too much, will you be willing to see a psychiatrist or a psychologist? No. But if you have a fever or a small symptoms like that, you might visit your GP or a physician and things like that. But when it comes to mental health, unless and until it has gone to that level that it starts affecting your functioning, you will not visit a psychiatrist. So I would say that certain, communities sometimes, or certain people from certain parts of the world, maybe the western part of the world, they might come to us with, my doctor, I'm feeling little low lately, I'm feeling little, I feel little sad and things like that. When they come in during that stage, yes, we can do counseling and therapy and things like that. And believe me, we don't want to start you on medications unless and until it's required. There is this negative thing, like, if you go to a psychiatrist, he's going to give you medications, and once you that's the second thing, once you start these medications, going to take it for lifelong. That is the second misconception.
So it's not like that, right?
It's like, how do I put it? See, we deal with more than 100 conditions. So being a psychiatrist doesn't mean that you are treating only those people who are termed or mad and things like that. Okay? So it's like you see a physician. It's not like everybody who is going to a physician is going for cancer treatment. You can go for fever, you can go for small issues.
Cold, cough.
Same way. To a psychiatrist, the most common presentation that we see is anxiety, depression, adjustment issues, stress reactions and things like that, for which medications do work, and it makes you feel better. It improves your productivity, it improves your functionality, and you don't compare that medications to somebody who requires severe medications and things like that. In those individuals, in fact, if they are not on medications, it's going to be more difficult for them. Ultimately, what we look at is functionality. Imagine a person who has hallucinations, hearing voices and things like that. Even with medications, they may still have a small percentage of voices and things like that. Just imagine that person not able to function. If they stop the medications, yes, the side effects may not be that much, but they'll not be able to function properly. So it's a balance about these things. But more or less, Usually what we do is the treatment usually lasts for about 6 to 8 months on an average basis for depression and anxiety generally.
Right. Okay, so I'm sure not only me, I have understood a lot of points with our conversation, but our audience as well has gotten a lot out of what we had to talk about. Where can they reach out to you? Can you tell them?
I have been in Qatar for the past 1.5 to 2 years now.
Yes.
I'm associating with Naseem Medical Center. I'm working in Naseem Medical Center. I was at the Searing branch. Now I'm extending my services to the Wakra branch as well on Wednesdays and Thursdays. So Saturdays to Tuesdays I'm at the Searing branch, and on Wednesdays and Thursdays I'm available at the Wakra branch.
Absolutely. Thank you so much for joining us today, and thank you so much for the conversation as well.
Thank you so much.
Alright, thank you so much for watching. You guys can comment down if you have any questions, or if are there any confusions or topics that you want to talk about right here. And thank you so much for liking and commenting and sharing this video so that we make sure it reaches the right people. Abhi ke liye, stay tuned. See you with us.